In Paris, health officials are saying COVID has worsened the chronic healthcare worker shortage, resulting in burnout and a sped-up track to retirement for many. Meanwhile, COVID cases are slightly increasing across the state due to the spreading Omicron BA.2 subvariant. And just today, the World Health Organization says it's tracking two more subvariants of the Omicron strain, BA.4 and BA.5. So joining us now to discuss all this and more is Dr. Omar Lateef, CEO and president of Rush University Medical Center. Dr. Lateef, thank you for joining us. Now, this recent uptick in cases in Illinois isn't nearly as high as it was during the Omicron surge. Illinois is reporting just over 1,400 COVID cases today. Now, that's up from 756 cases a week ago, according to the data from the Illinois Health Department. Now, that's in comparison to a high of more than 42,000 new cases reported on January 7th, the height of the Omicron, this surge. Is there still cause, Dr. Lateef, for concern?
Well, there's always a little bit of cause for concern, but I think the numbers that you mentioned are indeed sobering. But when you take them into context with hospitalizations, it presents a little bit of a different picture. When you go back to January and you quoted those large numbers, at the peak, there were over 7,000 admissions in the state of Illinois to hospitals. And that was creating a drain on the healthcare system. When you fast forward to this month, there's less than 500 admissions. And so while the numbers are increasing, the number of hospitalizations are actually decreasing. So while there's spread of the disease, there's not spread of acute and severe illness. So the threat of overwhelming the healthcare institutions are definitely lower than they've ever been before. And we know that people are doing significantly better with these new variants in terms of their response to the infection.
Now, when we spoke to you last, Dr. Lateef, it was in the middle of this Omicron surge. Your hospital, Rush, was experiencing a staffing shortage. How would you describe your situation today?
Well, we've shifted our thoughts of the staffing shortage from an acute problem to more of a chronic problem, to use a medical term. We are still surrounded every day when we come to work by heroes who are coming to work short-staffed in many ways. But what we know is that we have certainly enough providers to take care of all the patients that we have, as well as enough providers to actually flex up if we had to, if we ultimately went through another surge. The reality is we need to grow that net population of providers across the country, because the staffing shortage is not isolated to just Chicago. It's a national phenomenon. And while we've adjusted to it now, we leverage technology, we figured out other ways to help decrease the impact of the staffing shortage, and we'll continue to do so. Ultimately, we have a growing population, and we need to have a growing number of healthcare providers in this country.
You just talked about this a little bit as far as like leveraging technology. Give us a deeper sense, if you would, about how you and other health systems are addressing this shortage, how you hope to address this shortage, as you just mentioned.
Yeah, generally, whenever anyone asks me about the pandemic, I tell them it's the worst case scenario in just about every category. The only place where the pandemic may have actually improved healthcare in America is it forced us to advance technologically more rapidly than we otherwise would have. And so the best example of that are things like telehealth, where you can offer up and improve access to people that couldn't otherwise get access through telehealth, and then create a way, a almost digital front door to bring patients that need to come in. That's not just related to COVID, but that's related to all illness. And so we learned during the pandemic to be innovative and figure out how to improve access and get people the health care that they need without physically having to come to the hospital. Other innovative ways we've done that was to get care to people and bring back that sort of old wisdom of home visits. And the reality is, if we can provide care at home, then we can save that need. It's more comfortable for a patient there, as well as it doesn't utilize those resources in a healthcare system.
Dr. Lateef, would you say that, COVID, is it beginning to shift from pandemic to endemic, or is it too soon to say that yet?
Well, it does certainly seem like that. It does certainly seem. But however, I would say that the science behind the way we learn in healthcare is by tracking something over time and then reporting on it in retrospect. So when someone asks how long will this vaccine work, we give the vaccine to hundreds of people in a certain area. And then when they start getting infected again, we know that that vaccine effectiveness has gone down. So predicting how long a vaccine works, as you've seen played out throughout the world, has been very difficult. The reality is some vaccines last a lifetime, some vaccines last a short time. Here's what we know. We know that now when you look back over the last several years, or the last couple years, and we've had COVID come in surges and COVID deteriorate in surges, we've seen the response and critical illness of patients ameliorate. They're getting less sick over time. And so that does portend a prognosis that means we're going to shift into something very similar as a cold. I can't guarantee that. That doesn't mean that there's not going to be another variant that comes out like Omicron that spreads and does this again. But what we're seeing is an ebb and a flow, an up and down of this, and we're seeing increased herd immunity. We're seeing people's bodies get vaccinated. We're seeing people recover from the vaccine, and both are offering a level of protection. So it is very likely that over time, the long-term projection is that the acuteness will continue to decline.
And you just mentioned, herd immunity. Are we closer to reaching that?
Yeah, we are. So the United States of America is amazing in the sense that there is vaccine availability. There is enough vaccine for everybody in this country to go get a vaccine. And you can do that. And really, the numbers to get to herd immunity are somewhat complicated. Some people would say 90%, some 80%, some even 70%. We're not at any of those numbers right now, but we're certainly at a point where when you get up near 70, 80%, you see the acuity go down and you see hospitalizations dramatically decrease. And what's helped so much wasn't people getting sick. We were trying to prevent people from getting critically ill, people from dying from the disease. And that we're seeing from the rates of the vaccination uptick we've had. However, there's still nothing better than to continue getting a higher vaccination rate as much as possible. If we could vaccinate every single person in the world, there's reason to believe that this would go away.
So we've got a few seconds left, Dr. Lateef. Obviously COVID's not only taken a very physical toll on everyone, but a mental one as well. What do you see as the long-term impact of COVID on mental health and how that can be addressed?
I think over the next several decades, we'll be writing papers on the impact to mental health of this period in time. It has to do with regular people living their lives and what happened when you were stuck at home or when the cities were in lockdown. We've seen incredible rates of depression and incredible rates of anxiety. We have no idea what the effect of not going to school is going to be long term. So much of our learning comes from the trials and tribulations of being in school and going through day-to-day life. And we also know that healthcare workers have an unprecedented amount of mental health issues right now. And we don't have the resources in the country right now to take care of the mental health needs we have. So the truth of the matter is COVID exacerbated an already mental health crisis in this country, and we will continue to develop ways to improve access to the mental health services we have.
And created, of course, a lot of ongoing work for you and your team, Dr. Omar Lateef there at Rush. Thank you so much for joining us.
Thank you for having me.